Hi, my name is Jane MacDonald. I am one of the senior charge nurses here at NHS Lanarkshire. I am one of the nurse practitioners who work in the service. I've worked here for 2.5 years. My role here is to see, treat and discharge the paediatric patients who come in. So that's all the under 16s, which is about 40% of our patient group, and they get sent down from NHS 24, come into ourselves and get seen by our clinical support workers in the first instance, and then they come into myself where I make an assessment and then either send them home with treatment or on to our other kind of acute colleagues.
As the clinical director, my main role is to provide medical leadership for the service and to provide clinical governance for the service as well, to provide medical guidance for the management team and to help prepare things like clinical protocols and clinical guidance. In terms of referrals into the service, the vast majority of referrals come via NHS 24, so the patients would phone 111, their call would be triaged by NHS 24, and if NHS 24 feels that further assistance is required, they will then pass the referral to us. Around about 10% of our referrals come from professional to professional calls, from district nursing, from the ambulance service and from community pharmacy and 1 or 2 other services. There's no direct access for the patients and it's not a walk-in service.
Within my role, it's to look after the staff that are on board, to make sure that when the calls are coming in through the NHS 24, that we're passing them on to our doctors as quickly as possible for them to look at. Once the doctor has looked at it, they then send them back to our team, and we'll then organise either appointments or house visits, calls to district nurses. That's what we're responsible for. Generally, like tonight, I'll have 3 staff with me, and they'll take on board. At the weekend, it's much the same. We'll maybe run with 4, with split shifts from 8 till midnight, and 1 member of staff overnight to deal with the calls.
So I'm Laura Lawson. I work in out of hours and as an advanced nurse practitioner. I've been here for the last 4 years. I started as a nurse practitioner, done my training for my prescribing and my advanced assessment, and then I took the role as a trainee advanced nurse practitioner over the last 2 years, which started in the January just before COVID hit. And then I have done my training over the last 2 years and qualified last month as an advanced nurse practitioner in this area. Yeah, it is a really good team. The nursing staff, we've got a great team. It's quite a small team at the moment, but we're very close knit, and it is really good. And the one thing that I really like about being here as well is the GPs are very supportive. It's different for working in a hospital, so the GPs are there to get your support, to ask for help. They'll take you through your training, so they become your mentor when you start. You'll get assigned one, and then they'll help you throughout the training so that you've got somebody there to always turn to if you're needing some help and support, so it's really good.
The general practitioners that work in the service, there's 3 main roles that they fulfil. Some of them will carry out home visiting, some will carry out face-to-face consultations in the primary care centres, and the others carry out the remote telephone reviews for patients who've been referred by NHS 24. From a GP's perspective, having everybody together is fantastic.
I think we are a friendly team. Anybody who's came in the past, we've always had positive feedback from any GPs or nursing team who have came into the service. We all are very friendly and welcoming. We have got a good kind of induction programme to show people around. You're never on yourself, you always are working as part of a team. Although we are see, treat and discharge, there's always somebody to kind of ask second opinions, for example. So it is a good kind of a team feeling in the workplace.
From a GP's perspective, it's great having the team round about you. It's great having the patient ready and prepared by the healthcare support worker who's taking all the observations. It's great having the nurses on shift with you. Having everybody together is fantastic. It's a really good team.